All right, welcome to The Explainer. Today, we're going to dive into something really fascinating, a really mysterious problem that can happen with the human voice. We're going to crack the case of two very strange voice disorders. I mean, just think about that for a second. It's not a riddle. This is the very real central puzzle behind two really complex neurological disorders that get confused for each other all the time. So, let's start digging in, let's start our investigation and see what makes them so unique and, more importantly, how in the world do specialists tell them apart? Okay, let's open our first case file. Our first suspect is something called spasmodic dysphonia, or SD for short. Now, I know, it sounds like a really complex name, but it all comes down to what's going on deep inside your voice box, in the larynx.
So what is it really? At its heart, SD is something called a focal dystonia. Now, focal just means it's focused on one spot, in this case, the voice box. And here's the really crucial part. It's action-induced. That means the spasms only kick in when a person actually tries to speak. When they're not talking, their voice is basically just fine.
You know, the specificity here is it's wild. A person's voice can be totally 100% normal when they laugh or they cough, but the second they go to form a sentence, the spasms kick in. And you can see why. For years, this was totally misunderstood. People thought it was a psychological thing, a psychogenic issue. But now we know for sure. Its roots are buried deep in the nervous system. And get this, SD isn't just one thing. It's actually got two different faces, two opposite forms. The first one, adductor SD, that's the most common kind, is when spasms literally slam the vocal folds together, which creates this really strained, choppy sound. And then you've got its mirror image, abductor SD. This is where the spasms do the exact opposite. They force the vocal folds open, which leads to these sudden, breathy, whispery gaps in their speech. All right, let's move on to suspect number 2. This is a condition that, you'll see, gets mistaken for SD all the time. Essential vocal tremor. Okay, the key word you gotta remember here is rhythmic. See, unlike those sharp, unpredictable spasms we saw in SD, essential vocal tremor causes this consistent, rhythmic shaking in the voice, a kind of wavering. And here's another really important piece of the puzzle. This often isn't just a voice thing. It can be part of a much bigger tremor that affects other parts of the body, like maybe the head or the hands. So the big takeaway here is that this is really a movement disorder that just happens to show up in the voice. It usually crops up a bit later in life, and there's often a genetic link. It can run in families. And it creates this very distinct, very audible shake in the voice. And as we're about to see, the single biggest clue for doctors comes from a surprisingly simple test. Okay, so we've got our two suspects on the board, spasmodic dysphonia and essential vocal tremor. And here's the tricky part. In just a normal conversation, they can sound incredibly similar. So how on earth do specialists crack this case? How do they get to that final, correct diagnosis? Well, it often boils down to one single critical test. Okay, quiz time. This is probably the single most important diagnostic test they do. The key phrase to focus on is consistent rhythmic wavering. So, based on everything we've just talked about, which one do you think it is? What's the likely culprit here? And the answer is B, essential vocal tremor. If you pick that, you are spot on. That consistent rhythmic shake, it becomes absolutely impossible to miss when someone tries to hold a long, steady sound. The tremor? Well, it just has nowhere left to hide. And this right here, this is the key difference. Remember how we said SD is action-induced? It gets triggered by the complicated movements of talking, of putting words together. So a simple, sustained ah sound, it usually doesn't trigger those big spasms. In fact, their ah will sound surprisingly sable, pretty clear even. And that's what makes the diagnosis suddenly so obvious. So let's lay it all out in a final showdown. See, in regular conversation, they can be tough to tell apart. But during an exam, the differences are just night and day. SD gives you those irregular spasms, those voice breaks during complex speech. But the tremor? That's the rhythmic, consistent shake, and it's easiest to spot on that long ah sound. This kind of careful analysis, this is exactly how doctors solve the puzzle. So we've identified the culprits. Now what's the verdict for patients? What happens next? Well, unfortunately, finding a treatment that actually works can be just as tough, just as frustrating, as getting the diagnosis in the first place. And that diagnostic journey, man, it is often incredibly long and just plain discouraging. Because the symptoms can come and go, and they're so complex at first, patients just get bounced around from an ENT to a neurologist to a psychologist to a speech therapist. This hunt for an answer can be a really, really long and difficult road. But for spasmodic dysphonia, there is a glimmer of hope. The most effective treatment we have, it's not a pill, it's actually Botox injections. Yeah, that Botox. The procedure is called chemodenervation, which is just a fancy way of saying it uses a chemical to block the nerve signals going to those twitchy, overactive muscles. This gives the person temporary relief from the spasms, usually for about 3 to 5 months, and then they have to get the injection again. Now, this is a really powerful and, honestly, a pretty tough statement. Think about it, what it's saying. It means that when all the usual stuff, voice therapy, different medicines, when none of it works, it actually makes the doctors more certain that it's spasmodic dysphonia. It's like this cruel paradox that confirms the problem is a really deep neurological issue, one that, right now, we just don't have a cure for. And what about essential vocal tremor? Well, the outlook there is unfortunately even more challenging. Because that tremor is part of a much bigger movement disorder, treatments like Botox just don't work as well. The reality is, as of today, there is no single treatment out there that can reliably and consistently stop the shaking.
And that leaves us with a really big final question to think about. When you have a disorder that's pretty much defined by its resistance to being cured, how does that change everything? How does it change the way we even think about treatment? I think the goal has to shift, right? It stops being about finding a miracle cure, and it becomes about management, about improving someone's quality of life. It's about finding a voice, not through a single miracle, but through careful, persistent, and ongoing care.